I got it.
Roxy was not acting. Yelling at the person. Yeah, I know. Yeah.
Sorry. No, it's okay. Sorry, though. It's okay.
Down. Andrew. What's going on? Wanna go? Hey, good morning, Andrew.
Oh, it's right here.
Wow, that's a great answer.
Like I went so far away.
Andrew.
Yeah. If they are coming in, yeah, I mean, oh, wait, they It's not been too long for me to know it. Yeah. What do you mean, like, we don't do the milk?
But I've had some good vegan mac.
They've changed.
Seasoned vegan before they have the protein.
Season vegan.
That's just really supposed to be mac.
Yeah. Have you ever had the cow cheese?
Somebody else had it.
Remember I brought it in for you to try it? Cow. Not basically, she did like it at a time.
It was better now. None of it actually tasted.
What? I went to a university.
Good morning, everyone. Thank you so much for being here this morning. And kicking off this spring. So I would like to start with everyone introducing themselves, and then today's prompt is, what are you looking forward to in spring? Because we had a really long winter. Yeah, we're still having it. Yes, we are. I know. I was just saying to someone, I don't know what to do with my closet. It's like I keep pulling things out. I'm like, should I wear this today or should I wear? But I'm really tired of wearing my coat. So my name is Jackie Chang. I am the chairperson of the New York City Youth Board. And the thing I'm looking forward to the most this spring is riding my bike again. I have not done it in a while. So I'm going to pass it.
Yes, hi, everyone. Yes, welcome. My name is Saifullah. I'm a Davis City board member, and I'm looking forward to doing more outdoor events throughout the spring. So, yes.
I'm vice chair of the youth board, and very happy to meet you. I'm most looking forward to the spring coming on Thursday, and I have a lot of fun things planned for. So I'm looking forward to it.
Good morning, everyone. My name is Abube Weme. I'm the Youth Engagement Officer on the board. For this spring, I'm just looking forward to some good weather. Please, I'm also tired of the winter, so looking forward to it.
Good morning, everyone. I'm Artie Kurumo. I'm with DYCD, and I am looking forward to just having the kids outside.
Hi, everyone. My name is Erica Larson. I'm a data specialist at Purpose State Public Schools. What am I not looking forward to? I think honestly, like farmers markets and fresh foods and in-season produce. I'm really excited about that.
Hi, everyone. I'm Marilyn Kane, also with DYCD, and what I look forward to every spring is my birthday.
Alright, hi everyone, my name is Nadia Williams with the Office of Neighborhood Safety at DYCD. I'm looking forward to just being outside and actually feeling real sun, so I'm really looking forward to that.
Hi, good morning, everyone. I'm looking forward to seeing
Good morning, everyone. My name is Sharon Brown from the Office of Neighborhood Safety at DYCD. Something I'm looking forward to is spending time with my daughter this spring. This is her first, well, not her first spring, but she's a year old now, so she's able to do stuff. So, yes, she is walking.
Andrew Miller, DYCD's Assistant Commissioner for External Relations. I'm actually looking forward to kicking off our summer programming and bringing our commissioners to all 5 boroughs to visit these events.
I'm Chrissy Sudano, and on that note, I'm looking forward to my child being in summer rising. And out of the house. One more.
Yes. Oh, okay. Two more. Yes.
Hello, everyone. Sorry I'm a little late. Ron Chiogolea, Office of Neighborhood Safety, DYCD. And one thing I'm looking forward to is spending time with my parents. So they're in Maryland. I go back and forth, but I haven't been able to in the last couple of months. But looking forward to that.
Right on time. Hi, everybody. I'm Ray Singleton, Assistant Commissioner of ACS with the Seattle County again. I'm looking forward to some warm weather and hanging out with my daughter who's in her close to her life.
All right, to everyone for sharing your spring hopes. Wait, just this. I'm afraid the commissioner will not be joining us this morning. She has been pulled away, and Sandra, and I hope I say this right, Escamilla, right? Davies will not be here this morning, but we're as far as next morning. I would like at this time to turn the mic to Andrew Miller, to update us on the new legislation that impacts our board.
Thank you so much, Madam Chair. It's great to be here this morning. First, I would like to send again the Commissioner's regrets. She's unable to be here, but she wants to come next time, certainly. It's been a very busy time for the Commissioner. She's only been here for a few weeks, and she already, last week, she testified before the City Council on DYCD's preliminary budget for fiscal 2027, and it actually stands at $1.6 billion. Which is, last year's preliminary budget was $1.2 billion. So it really goes to show you the investment that we're making in young people. In terms of the community needs, like we all talked about the CNA, the community needs assessment, we actually got now over 20,000 responses. I want to thank the Youth Board for your advocacy to get people to fill that out. We hear from our teams, the Office of Neighborhood Safety in a little bit, so I'll let them cover that. As you know, last Thursday, Mayor Ndang announced that we are standing up a new Office of Community Safety, so I guess our team can talk a little bit more about that. Summarizing, we're getting a record number of applications for that. The portal opened on March 3rd and will close on March 27th. We actually did a youth count for Running English Youth last week. We're very happy with that. And we're working very hard to get those 103 beds online. And we had a record number of applications for the Summer Youth Employment Program. So that's all great news. The other thing I want to talk about, and I actually testified, I think it's in your packets, about, I testified about the great work before the City Council about what the Youth Board does and their advocacy for young people and improving our programs. And they actually made some significant changes to the Youth Board. The mayor has not yet signed that bill. I think it's going to be signed shortly. But it would reduce the number of board members from 28 to 20, with an even split between the mayor and the council appointing them, as well as term limits. So we look forward to working with the Youth Board in the time ahead to take that legislation and to change our bylaws to reflect those changes. So I always appreciate everyone's leadership here.
And Andrew, thank you so much for testifying on our behalf. You were wonderful, and I did watch it online. Yeah, it is, and it's really great. So a couple things. I do want to inform you that we have currently 18 board members. So we do have 2 vacant slots based on this new legislation. As soon as it's signed, it's not signed yet. And we hope over the next probably quarter to look at really the board makeup, to see to basically see how we can all move forward together in a partnership with our new commission. So I just want to say that's what we're going to be looking at for our next board meeting. Now I would like to turn our attention to the minutes. We need to read them from our last December meeting. So it should be in your packet. And if I could get anybody, if there's a motion to approve, second? Thank you. So minutes approved. We have presentations.
Yes. So, our colleagues from the Office of Neighborhood Safety in here, and they're going to present for us, so we have to kick it off.
Go up. So good morning again, everyone. You're gonna hear from a few voices. I do want to preface by saying that the Office of Neighborhood Safety is very big. We're a $133 million office, so what you're getting today is very high level and just touches at the surface of what we do, but we hope that it starts our conversation. And please ask us questions.
Hey everyone, so we can start. So what is the Office of Neighborhood Safety? The Office of Neighborhood Safety, I actually.
Oh,
Okay. I gotta put my Darryl voice on, so. All right, so the Office of Neighborhood Safety combines the Mayor's Action Plan for Neighborhood Safety, the Office to Prevent Gun Violence, most of you know them as our Crisis Management Systems teams, and Atlas. And we do this to strengthen community safety, healing, and well-being by using the experience and expertise of community to drive solutions. So communities that have historically been disinvested, we want to ensure that they have access to equitable resources so they can become thriving community members. So that's in a nutshell, right? Holistic approaches to community safety. And our vision is that ONS imagines a city where every New Yorker can walk through their neighborhood without fear, where individuals and families have the support needed to move from crisis to stabilization, and where local communities have the resources they need to design what safety looks like in their own communities. We definitely believe that community members closest to the harm should absolutely be a part of the solution making. And so our mission is to reduce community violence among the people and places at greatest impact via precision prevention strategies, interagency coordination, crisis response, and stakeholder engagement with those closest to lived experiences of community violence. And if I went around the room right now, and I'm not gonna do that, and I asked you one thing that makes you feel safe, everybody would have something different, right? So there's not one, and so we use that experience and that expertise to actually come up with our solutions. And I'll pass it to our crisis management system team.
So as Ronti mentioned, I'm like Ronti. So as Ronti mentioned, the Office of Preventing Gun Violence, also known as CMS. So CMS is the crisis management system. In 2014, the crisis management system had delivered street outreach, conflict mediation, and case management to thousands of individuals and families citywide. Basically, essentially, to create pathways of opportunity for healing, opportunities in healing for New Yorkers most affected by gun violence. So what that composes of, the Crisis Management Network is comprised of more than 50 community-based organizations. So we have 50 CBOs, so that covers all over, right? And essentially what that does is it aims to reduce gun violence by engaging those that are most elevated for risk in being involved in community violence. So what does that look like? We have high-risk participants, we have low-risk participants, we have participants that are just as involved, we have participants that are possibly on the spectrum of being just as involved. So what we do with the Crisis Management System Network is we allow to be able to engage with all of those that are at risk in some type of risk. What we want to do is essentially place ourselves, CMS, our network, in those opportunities or in those spaces to reach participants, to reach community members, and to reach all that are involved in community violence. So what does the crisis management system look like? Because again, it is a network. So we have 44 cure violence catchment sites. I'll explain a little bit more what a catchment is in a second. We have 2 public safety coalitions. We have 50 schools and campuses. So that means either independent school or campus versions of a school. We have 8 hospitals. We have 10 ACS facilities. We have a Rikers Island mentoring program. And then we also have 5 mobile trauma units plus more. Now, we do have a plethora of wraparound services that goes into the crisis management system. However, due to time, I won't necessarily go into all of those. But those can look like mental health and trauma supports, that can look like grief and trauma supports, that's community healing and wellness, survivors support groups, we have a plethora of things. Essentially a way that we are able to help all of our youth, help our community members, and be inclusive at all times. So, Cure Violence, street outreach. A lot of you guys have heard a lot about our Cure Violence approach and what we do within CMS. To myself, I want to say that the Cure Violence approach is kind of like the meat and potatoes of CMS. So we have Cure Violence and everything else is kind of, I don't want to say an add-on, but essentially a wraparound service, right? So it's a way to help connect the Cure Violence with all of these additional resources and ways that they can pan out for our community. So at the heart of the CMS is the street outreach models. So we have 18 community-based organizations that are trained specifically in our Cure Violence approach to violence interruption. And they operate across 29 of our NYPD precincts. That's a lot. That's a lot of precincts to be operating of, and that's also a lot of providers to be doing this work. So across these 29 precincts, they basically account for 75% of the city gun violence each year, which is not 100%, but I want to say that we're making some headway. We're getting there, three quarters of the way. I think that's pretty great. So essentially, what does the Cure Violent Street Outreach model look like? One, it interrupts conflicts before they turn violent to de-escalate and mediate ongoing conflict. So we have Cure Violence teams, we have credible messengers that are able to go into the community and speak to interrupt conflicts, really to go out and really be invested in their communities, be invested in those that are just as involved, and really be able to have those conversations to denounce violence. Then we also have, we provide mentorship and risk reduction planning to those at the highest risk for gun violence and community violence. Something that we really do center ourselves on as well is youth engagement, right? Ensuring that our youth who are, they are very easy to be, excuse me, the word that I'm looking for. Thank you, you guys. Thank you so much. They're so easily to be influenced. We want to ensure that we're always in the place to provide mentorship opportunities, but also provide resources that they need in real time. And then also shifting community norms through public presence, events, and healing spaces. What public presence, events, and healing spaces can look like is shooting responses. So 72 hours after a shooting occurs, our teams, our credible messengers are to go out and provide a shooting response to denounce violence and basically to advocate for their community. Also through events, we have resource fairs, we have healing and wellness events, we have youth events, we have all different things. But then when it comes to healing spaces, we have healing circles, we have mentorship programs, we have healing programs, we have therapeutic programs, all of these things. So again, within our Cure Violence, we use that as our meat and potatoes, and then we kind of utilize the rest of our wraparound services to bring more support into our communities. So now I'm going to pass it on to Lucilis.
Hey everyone. So just stemming from the Cure Violence model and the fact that it's a public health approach, we also have the hospital response program. This is referred to as the Hospital Violence Intervention Program, and we service across 4 public hospitals and 4 private hospitals across all 5 boroughs. The impact of that is due to the fact that we are combining community-based organizations, peer-to-peer models, to come at the bedside of folks that come in with gunshot wounds, assaults, and stab wounds. At that juncture, it complements the Cure Violence model, because if folks get hurt during that shooting response, we have a direct connection to them at the hospital level, and our peers are able to reintegrate them into the community, refer them to actions that, or refer them to services that address their social determinants of health in order to properly prevent violent events in the future. Now, the reason that this works together with the Cure Violence models, because those 13 CBOs are also Cure Violence sites, right? With the exception of one, which is the Public Safety Coalition in North Brooklyn. The Hospital Response Program is one of our primary standalone programs, and it equips our hospital responders, which in the public health department would be called community health workers. And so we talk about youth a lot here, and the primary focus is why did we bring this one up as opposed to our other programming. A lot of youth come into our trauma centers here, and it's a primary touch point for our CBOs to be able to give them wraparound services, but also to understand what provokes violence and violent behaviors as well, to be able to really intervene through risk reduction programming. If we go to the these are youth enrichment services programs. So you may be asking yourselves, where are we located? We're located in 50 schools, either campus sites or individual sites. And we're there because they've had a large number of level 4 and 5 incidents. This approach allows for our community-based organizations to bring in folks that are prepared to do programming like workshops, but really they get to do safe passage and address some of the concerns that the campus may have or the school may have through engaging at-risk youth that have been identified by the school administration, but they also understand the landscape a little bit better of the relationships between the students, and they're able to do one-to-one intensive case management that will allow for them to hopefully use critical thinking skills and no longer engage in violence. And then we're bringing this one up because it's the youth board, right? This is our second one that Honestly, it's incredible the work that we are able to do. So in youth detention centers across the city, we have community-based organizations, again, all stemming to the Cure Violence work, that come in and provide mentorship services, workshops, but really they get to know these students in a way that will prevent violent events from happening in this confined space, and also allow them to reintegrate into their communities and refer them again to those social determinant of health gaps that they may be facing in their communities. All three of these programs have intersections with our youth at a large level. And we really want to expand and elevate the work that our peers are doing in a way that is effective and people can understand how we're integrating public health into violence prevention here. So I'm going to pass it on to my colleagues.
All right, so you heard from one initiative. We're going to transition to the Mayor's Action Plan for Neighborhood Safety. MAP, I'd like to say it started from a place of tragedy. So in 2014, as crime was trending down, as is similarly happening now in NYCHA communities, there were 15 NYCHA sites that were accounting for about 20% of violent crime. So the administration decided that public housing had to be the focus for public safety. And so that's how the Mayor's Action Plan for Neighborhood Safety was developed. We've since expanded, so we're now in 30 NYCHA communities since 2022. And really, the core of our model is called Neighborhood STAT. And simply, it's bringing NYCHA residents, city government, and CBO partners at the table to not just identify public safety priorities, but to come up with solutions together. And I always say, this is pretty innovative because typically, when we talk about public safety interventions, that tends to live in government and academic spaces. We don't always engage the people who are most impacted by violence, the residents who are experts in their communities and understand what they need to feel safe. And so that's what the Neighborhood STAT model does, because it brings residents as stakeholders to the table. They understand what they need to feel safe, they understand what their community priorities are, and government is at the table to not just listen to residents, but to be responsive to them. And this is particularly important. We want the government to work well in every single community, but we understand that there are years of disinvestment, particularly in neighborhoods, Black and brown neighborhoods that are poor, that are under-resourced, and so that's where MAP shows up. One of the core pieces of our work is SubTED. SubTED is crime prevention through environmental design. I'll say that's the origin of our work, where we're really thinking about the built environment, the physical and social environment, and how it contributes to safety or lack thereof. So oftentimes, if you go into NYCHA spaces, you will see scaffolding, you will see garbage, you will see lack of lighting. And so what we aim to do is to help residents lead the charge in helping to identify those spaces that need investment and go in, work with them to come up with creative solutions together. Okay, so I want to share an example of what that looks like at a hyper-local level. So I know in the beginning, Monty talked about like every single one of you has an idea of what it means to feel safe. And even though those might be different things, I think we can all say that we want spaces that are well lit, that are activated, that your family feels safe in. Everybody has that similar sense of safety. And what we're going to talk about today is an example in Wagner Houses, which is a MAP site, and how residents really led the charge to come up with a creative solution to public safety. So what you're seeing in this photo, the top half, is two, what are those? Containers. They're actually storage containers that NYCHA left on the campus. And so we did a public safety audit with the residents who live in Wagner Houses, NYCHA representatives, MAP staff, and we did a public safety audit in the daytime and in the night. And what residents told us is that these two containers at night actually was a space for a lot of illicit activity. There was robberies, there were rapes happening. People felt unsafe in their neighborhoods interacting with these two containers. And so this became the focus of their community project. And so this is the after. So what they did, they transformed the space into something beautiful, into like a stage area for them to have events. So they created a mural, they added lighting, and they were changing the perception of how this space was being used in your community, which is super important. So instead of associating these two containers as a site where people didn't want to hang out, people don't want to associate with, they're suddenly using it as a space where they can host community events, they can host healing circles, and people felt safe being in this neighborhood, both in the daytime and the night. And that's the power of community creativity and government really being responsive, because I'm sure if we just came in and said, hey, Wagner, we're just gonna bring some youth programs to you, it wouldn't be addressing their specific needs. So that's what MAP's approach is about. So like the crisis management system, we have a suite of wraparound services. I won't go into all of them, but just to say that each one of them is really about making sure that we're providing targeted resources to NYCHA communities. The fact is that if these resources are not in these spaces, the stakes are so much higher, right? So we're not in certain communities for a reason. We're not in really wealthy spaces. We're not in overly resourced spaces. We're in the spaces where it really matters if government is showing up correctly or not. Okay, I'll wind down and just end with This is the Youth Board to highlight one of our key programs. And I'm actually passing to Ranti to talk about all of this.
That's our youth leadership coordinator right there. So, as Nordia said, MAP operates under 5 priority areas. And so, safety and justice, health and well-being, economic stability,
Safety and justice.
that's it, safety and justice, physical space, and our last one is the youth leadership, right? So the Youth Leadership Council is the physical embodiment of our 5th priority area. And so what happens is, for 9 months, we have 60 young people from our 30 NYCHA communities that come into the space, 16 to 22, and what we do is they're able to actually pretty much mimic the process that we have in NSTAP. So our young people come into the space, they talk about issues that are important to them, that are affecting their community, and what we're able to do, we do a participatory activity where we give them $65,000. And they're able to use that money to invest in an issue that's impacting youth across the city. And so this is a 9-month program that actually pays our young people $400 a month. Because not only do we believe that community members who are coming, who are historically being disinvested, should be at the foot of the table, but we also need to give them these resources, right? This is life-changing. So I think that's really one of the biggest pieces of our work, is allowing our young people to lead that process. I don't know if you want to add anything else.
No, I think again, like Randy said, the YLC is an articulation of our youth development priority. And I think again reflects the importance of government not just saying, we're gonna go into these spaces and we're gonna listen to community, but this is really about investing in the priorities and centering young people's voices. And so in addition to building your leadership skills and your civic engagement skills, what we're really telling young people is that you have a place in policy making. You should be at the table when it comes to talking about public safety interventions in your community. And we model that in all of our processes. So one of the things that we do is we invest $65,000 every year to the council to come up with a community project that they want to design in their neighborhoods. And they've done a suite of programs. They've done pop-up mental health events across parks in New York City. And they told mental health providers, here's how you make these services more accessible to young people. They've done cleanup days in NYCHA communities to send a message around stewardship and saying that we need to keep these spaces clean because that impacts people's perception of safety in communities. They did a healthy relationship pop-up in community centers across the city where they were saying that young people need to understand what it means to identify healthy and non-healthy relationships, and how do you make sure that they have the tools to navigate these different scenarios. They've done one of my favorite ones, the food security intervention, where we worked with a teaching chef. They gave out fresh produce to the community. They built a demo to tell people how to create healthy foods, young people, and they also built a recipe book that was designed for youth. And again, what we see are creative people who understand what it means to be safe in their communities, and government being responsive at every step of the way to make sure that community needs are centered.
That was the mic drop.
All right, so that was it.
Yeah.
Thank you.
Thank you. Do you have any questions for us?
I have a quick one. It is on.
Okay.
Yeah, you did it. My question is, thank you so much, and you're doing such a wonderful job. It's so fast. And I love hearing about how these different components are brought together, because it does have to be holistic as a mission. So what currently do you all feel are challenges? I know, right? But just in general for the board to understand.
I think there's a couple of challenges, like she said. I think for me, I think in terms of implementation and scale, I think it's hard sometimes. I think when you think about city government, sometimes it's hard to get city to respond in a way that, builds trust in community. And that's the big thing for us, right? We understand that we have to move at the speed of trust. Sometimes that takes time, but we need to make sure that when we do move, right, it's with community, right? And we don't move without their voice. And so I think that's really important. But I think one of the hardest things for us is to get city partners to kind of like buy in to this approach to public safety, right? Because a lot of times public safety lives in law enforcement, right? And it's in that mind frame. So shifting city government would probably be, for me, one of the hardest things that we
Are you, so that I understand this, what I'm hearing is that you would like to see a more across the board attitude or understanding, and that this idea might be able to be instilled in all city agencies, so that if you would be able to move faster.
Yeah, I think that's part of it.
We want them to do better than understand. We want them to be responsive. We want them to be flexible, which is very, very hard for city government to do. I think our work teaches us that to do this work correctly, to be responsive to community needs, city agencies, have to think that they have a stake in public safety, and it's not just police, it's not just ONS, it's not just, you know what I mean? Like HRA has a role to play in this, DOE has a role to play in this, like DOT has so like shifting government means that government, one, has to come to the table saying public safety is a priority for us, and two, the ways that we do government typically might not work in this circumstance if we're really going to be responsive to government.
I'd like to piggyback off the fact that we were talking about understanding. So part of understanding is investment and data collection. And unfortunately, some of our data collection markers do not mirror what investors want. And that means that either there's a disconnect or folks are not completely understanding the story.
To say something that's general about your overall work and workforce development, but specifically about the work that you're doing at ACS, and I think this question applies to both. So I wonder, in the 10 facilities or programs that you're in ACS, is there an integration point in which you're connecting families as a whole, but also youth, to the city's workforce development programs, especially like DYCDs, internships?
In regards to our ACS facility, all of the things that you mentioned are being tracked in regards to just mentorship and betterment, right? We also have re-entry programs that we try to ensure that all of our participants are a part of in our ACS contracts. But alongside that, they receive a plethora of workshops each and every day. They also are involved in different activities as well as involved in different events. We have an event that happens across all of the ACS facilities, in which is called facilities have a CMS provider that is attached to the ACS facility that provides the workshops, provides all of the activities, the mentorships, all of those things, the de-escalation mediations for the actual ACS participants. And with these unheard events, they have the opportunity to come and share stories with the Cure Violence providers that are there, and they're able to share stories back. Again, if we haven't mentioned before, a lot of our credible messengers and Cure Violence providers have, one, been just as involved, two, may have been in these ACS facilities. So it's really that time where they get to have that real connecting moment with them, which I think is very important in the work that we're doing, ensuring that we're able to relate, we're able to meet people where they are. But outside of that, when it comes to like workforce opportunities, we do look for workforce opportunities. If a participant is in, I don't want to say good standing, but they are, working towards that lifestyle, then they are possibly a junior VI, right? Which is programs that we have in our Cure Violence programs where you can come on to be a junior VI, you'll learn how to be a violence interrupter, you'll learn about being a credible messenger, you'll learn about the community, how to advocate for your community, how to work better in your community, all of these things. But then we also have programs where they can receive OSHA training, right, after they are outside of the facility. They don't necessarily receive too many workforce opportunities inside necessarily because it's very hard. A lot of them are training based or things of that nature, but they are receiving those re-entry skills that they would need to come back into the workforce and into just the real world.
And who would I connect with to
At the Santos.
have us Santos?
Yes, we can provide
We
it.
can-
Yeah, so.
Anyone else? I have, oh, good.
I just have a quick follow-up question. Cure Violence Cure Violence and Violence Intervention has been so incredibly successful. And I've seen it on the ground with the CBOs that you all have supported in some of the worst places, and it's just a game changer. Is there an effort to expand that further, or like how is that looked at now?
I think we all would love to expand further, but I think with expansion comes funding, right? If you know how that works in the city of New York. And then also in our catchment areas, they are quite expensive, right? To have our organizations working in these small catchment areas. So I definitely would love to expand. I know our entire team would love to expand. I know the crisis management system would love to expand, but I think in time, it will come, and I think it will come also with additional funding.
And just adding to what Sharon was saying, this particular year, we actually expanded into Canarsie, and that's a council-funded catchment. And that expanded to Mount, on the Canarsie area.
Thanks for saying Mercedes.
Yes.
Yes, thank you for your presentation. I just have a very quick question. Does the Office of Neighborhood Safety, do they help connect youth to community service activities? Especially, I'm going to say, like community boards, like the Queens Bar president is looking for diversity of members from different backgrounds. So do they help them to connect to apply for these positions, get involved from a young age?
Yeah, so on the map side of things, that's definitely what we're trying to do. We just recently have a new youth leadership council provider, Global Kids. And so Global Kids is you clap it up, they're very well known for youth development and the work that they do. And so just their network alone has allowed our young people to reach different spaces that traditionally they haven't. So we're really excited. Just recently, they went to Albany, they went to DC to meet with a council over there. So they're being able to reach, like you said, these spaces that traditionally they haven't been. And I think that's the beauty of us having a council here. We actually meet here. Our young people come here Mondays and Tuesdays, right? So it's important for them to see what power actually looks like in where city government and how they can navigate themselves.
As an addition, our Cure Violence site, so I'll use an example, Guns Down Life Up, do have integration programs for the youth after school program Bs, I guess we'll call them here. And so they're directly involved with the DA's office and also the Bronx Borough President, and they've been identified as youth leaders. And so that's just one example of how we're trying to get them civically engaged. However, I do want to manage our expectations as well, because some of our youth may be civically engaged in a more silent way, because they maybe don't want to see themselves as public, even if it's something positive, right? So that's another piece that our teams tactically help, but civic engagement is a priority for all of our sites.
I actually have one last question. So I'm really glad to see murals done, because as an artist and as somebody who has done lots of youth programming around the arts. I was wondering, in terms of getting more cultural institutions involved in safety, because it's, you know, you touched upon the idea of how the environment plays such an important role in our feeling of safety. And it's, for me, it's also a very aesthetic issue. So I would like to hear a little more about your engagement with cultural institutions, artists.
Yeah, I mean, a lot of the work that we do with the built environment, it's through our local neighborhood stack process, which is our participatory budgeting exercise, which we lead each year in the NYCHA development. Residents have the opportunity to vote on one of 5 projects, and if the physical space, to go back to our priority area, wins, then they have a couple of options. They usually do like a park or a mural or a garden, and then we engage local artists to implement the projects. But certainly we could do more when it comes to engaging cultural institutions, because there's a desire and certainly a need that residents have articulated to us about making sure that we're beautifying spaces across NYCHA.
Yeah, and I would encourage looking into locally established cultural organizations, because there are so many across our city.
Yeah, and the beauty of it is that we have a licensing agreement with NYCHA to do these across our 30 sites. So it's very easy for us to get a permit to do this.
Thank you.
Thank you all so much for your presentation. I echo everyone's thoughts. Just to kind of back ONS up a little bit, I'm the youth engagement officer on the youth board, but I also work closely with an organization called the NYC Youth Agenda. And on the NYC Youth Agenda, we have members of the office of ONS there, and you know, through their advocacy and in the work that we do this year, in the past we've had issue areas like environmental justice, right? But coming into 2026, through ONS and through their thoughts and contributions, we've been able to change that from just environmental justice to like neighborhood well-being, right? So that way we're not only just focused on what's going on in the environment, but we're looking at, now we're going into things about like urban planning, right? We're looking at the well-being of people, health-wise, and what they're doing, and yes, thank you. And what's going on in those communities as well. So ONS has been one of our partners with in building out the NYC Youth Agenda year after year. This is year 6 now, and they've been partners with us from the beginning. So thank you for the work that you're doing, and yeah, I look forward to more partnerships in the future. Also, shout out to Sharon. We just, you know, we recently completed a project management course together, so got to Good to see you again. Good to learn a lot about the work of ONS during that time. So shout out.
Any other questions that ONS is not, I want to give you one quick.
Yeah, of course.
1, 2, 1, 2.
So yeah, one quick update that as of last Thursday, Mayor City, along with that announcement was that the ONS team will now transition over to the Office of Community Safety. So ONS has been the integration of both ONS into the DYC ecosystem and vice versa. So now arming the map providers, CMS providers, Atlas, with additional resources in their toolkit that they can provide to families, young adults that they serve, and communities that they serve. So while bittersweet, because we love them, we also know that from New York City across the board, that this is going to be an exciting time that we're all going to be a part of.
Great, thank you so much. All right. Is there any more board business anyone would like? Because we don't really have any more. So I would like to call the adjournment to our meeting. Anyone? But one more second. All right, great. Thank you to everyone so much, and thank you for being here and presenting to us and informing us. today. That was really important. Yeah, go Cured. All right,